Well, welcome back, EMT students. Here we are with Chapter 5 in Medical Terminology. Now that we're 4 chapters in, I'm sure most of you have already figured out that medical terminology is kind of a big thing. And there is a lot of new words and new things to learn out there. Hopefully with this chapter, we'll kind of start to break down some of the mysteries behind medical terminology and these, big $10 words that you're seeing and that you're going to see. Let me tell you this, though, it's not going to change. It's going to get more difficult from here as you proceed through your textbook. And the more terms that you come across, medical terms that you come across. So, like I told you at the beginning of this, at the beginning of Chapter 1, take the time to look up these words. When you come across a word that you don't know or you don't understand, take the time to look up that word, break it down so that you understand it. The more you do that, ironically enough, the less you'll need to do it, because you're going to understand those words a whole lot more. That simply going through the process of looking those words up and breaking them down and understanding what their meaning is, you'll find yourself beginning to remember some of those component parts. And that'll make sense once we get through this chapter here, what I'm talking about when I'm talking about those component parts. You'll start to understand what they mean. Now, this is one chapter over medical terminology. Realize that there are entire courses devoted to medical terminology, semester-long courses. So just by taking this chapter doesn't make you a medical terminology expert, far from it. Even if you take a college course in medical terminology, you'll quickly learn that there's a lot to know about it, and you're not going to be an expert at it by taking one class, let alone taking one chapter. So don't think this is the end-all be-all that you need to know about medical terminology and this is the end of the game for this chapter. It is not. This is just an introduction to medical terminology that you're going to need to know and have a working knowledge of from this chapter forward throughout the rest of this textbook, and then on into whatever future endeavors of a career in healthcare. So keep that in mind with this chapter. You're not going to see a lot of test questions over medical terminology. However, it is going to be a part of every sentence that you're going to read from this point forward. So it's really important that you understand how medical terminology works. It is really a pretty fascinating system. So as I've mentioned before, you need to have a good working knowledge of medical terminology, because we're going to communicate and document using medical terminology, and you're going to be reading medical terminology of these terms that medical and healthcare providers use. So you must be able to understand them, not just the terms and the words that we use, but there's certain symbols and abbreviations that are commonly used as well, that it's really important that you understand what each one of them mean, because it can have an impact on the care that you provide. You can figure out the meaning of an unfamiliar medical word by understanding how its terms are formed and by learning the definitions of the component parts. See, the good news is you don't have to memorize what each individual medical word means. If you understand the component parts, or the small pieces of each word and how they intercorrelate and they're used in different words, if you understand the small parts, it makes it a whole lot easier to figure out the entire word. You'll see what I mean here in a minute. Understanding this medical jargon is going to help you communicate effectively with other members of the healthcare team, as well as EMS and other public safety teams. So medical terms are made up of distinct parts. Each one performs a very specific function. Changing or deleting any of these parts can significantly change the meaning of the entire word. So it's important that we get it right. When we look at these individual parts, there's 4 parts that we're really dealing with. Doesn't sound so bad, right? The word root is the foundational part of the word. It's basically what the whole thing's about, what the nuts and bolts of what it is that we're talking about. It is the primary thing that we're talking about. However, there's more to it than that. Then we have this prefix, which is the part that comes before the word root, and a suffix that comes after the word root. Then we'll have these things in there called combining vowels, and these vowels are used to join one or more words or word roots together to form a particular term. So we'll talk a little bit about those combining vowels. I am less concerned about you understanding the combining vowels, because they always seem to kind of fall into place once you start to understand all of the different component parts, prefixes, suffix, and root words, and what the different types of those are. The combining vowels just seem to kind of fall into place naturally more so. So won't spend a whole lot of time there. So the way that these term parts, these pieces of these words are combined, determines that word's meaning. Accurate spelling is essential. This is always been a big struggle of mine, but the use of electronics and spell check is our friend, and it kind of helps get us through. These spelling it correctly, because if we superimpose one single letter in a particular word, it can change that word's entire meaning. Here's an example. The suffix phasia with a ph, phasia, means speaking, while the suffix phagia means eating or swallowing. Big difference if we superimpose the G and the S. It can really mess up what the word means. So similarly, dysphasia means difficulty speaking, while dysphagia means difficulty eating or swallowing. So when we're communicating information, whether it's in the written word or spoken word, with other healthcare providers, and we're handing that patient off, if we give them the wrong thing, it's probably not as big a deal when we're talking about eating or swallowing. But with other things, it can be very problematic if we don't get the terms right. So, accurate spelling is essential in medical terminology, so it's important that we spell it right. Knowing anatomy and the context in which words are used will help you correctly determine and spell the right medical term for a given situation. As I've mentioned to you before, I'm not a great speller. I struggle at times quite a bit with spelling. I will tell you though, I don't struggle with spelling medical terms, with medical terminology terms, because the rules are very black and white. They're very clear. There's none of this I before E except after C, and silent K's and all that kind of stuff like we see in the English language. We don't see that. I'm not saying there isn't any of that, but we don't see it to the level in medical terminology that we sometimes do in the English language. That gets very confusing for those of us that like things black and white. So it is a lot easier to be a better speller using medical terminology. So no excuses for those of you that have spelling struggles like myself. There's no excuses, because if I can do it, you can do it. Trust me on that. So let's break down these different terms, or these different parts of this. We'll start with talking about word roots. This is the main part of the word, and that is kind of the crux, or what it is that whole word is about. It comes down to that word. The word root conveys the essential meaning of that word, and it frequently indicates a body part. Oftentimes it's talking about a body part or a piece of a part. I know that sounds kind of weird, but sometimes it does talk about a piece of a part. But that's what the word roots do. Most medical terms have at least one word root, but we realize that some may have more than one. So you create a full term by adding a prefix or a suffix to the word. Don't have to have both, but you need to have one or the other. Most of the times it's a suffix, but sometimes it's only a prefix. So changing a prefix or a suffix will change the meaning of the entire term altogether. Some word roots can also be used as prefixes or suffixes in other terms. Don't get all caught up or off into the weeds about what whether it's a prefix or a suffix, or if it's two root words in there or whatever, you'll know what the root word is, or the word root is. As long as you know what the primary thing of what that word's talking about, you're going to be fine. When we start to break down a few of these, you'll kind of see what I'm talking about. So now a prefix is a part of a term that appears at the beginning of the word. They're often used to describe a location or an intensity. A prefix gives the word its specific meaning, so it helps kind of really narrow it down, kind of drills down into it. Learning common medical prefixes can actually help you figure out the meaning of very unfamiliar terms. It's really surprising once you understand the prefixes, suffixes, and the root words in all of these, how much these really big and complicated words begin to just fall together. It doesn't happen overnight. As I've mentioned before, it takes practice. You're going to have to take the time to look up these words and kind of break them down on your own in order to understand them. And it is essential that you do that, because that's really going to make it a lot easier moving forward. The more you begin to understand those words, and it becomes much more natural to you as opposed to feeling so foreign. And the only way it becomes natural is through practice and continuing to do it. So suffixes, on the other hand, are placed at the end of words. They're also used to indicate a procedure, condition, disease, or a part of speech. So they can kind of fit into a few different areas here, but typically we see this repeating pattern. Most of the time, these four areas is where they'll kind of fit in. It's not always that way, but typically that's how we see it. And then we have these weird little things out there called combining vowels. They connect a word root to a suffix or another word root. The most common combining vowel that we're going to see is O, but it can also be I or E. A combining vowel is used when joining a suffix that begins with a consonant or when joining another word root. So there's some rules that we follow when we're using combining vowels. The combining vowel helps make the word easier to pronounce, and a combining vowel form is a word shown with its combining vowel. So sometimes we'll show a word root along with its combining vowel that it would use when it's being connected to another word. And we'll see some examples of that here in just a little bit. So some rules for this, for when we're talking about building words or how these words are built. The prefix is always at the beginning of a medical term, but not every single term will have a prefix. The suffix is always at the end of a medical term. Using a combining vowel when a suffix begins with a consonant to make the term easier to pronounce. So we'll always use that combining vowel when the suffix begins with a consonant. If it doesn't begin with a consonant, the rule may change. Okay, so just keep that in mind. You also will use a combining vowel between two word roots, even if the second root begins with a vowel. That's where it gets a little confusing. Like I said, though, what the neat part about this is it really kind of makes sense. It kind of flows together. So don't get all caught up in trying to memorize these rules. I mean, yes, they are important to understand and have a good, have some working knowledge of, but they'll start to make sense once you begin to apply them a little bit more, or when you start to kind of break down some words. So here's the plural endings rules when it comes to the plurals of things. So now, and this is seriously, this is just really for informational purposes, but it is important that you kind of understand how the plurals change. So when we need to make a medical term plural, we can sometimes just add an S, but there are instances where we can't do that and the rules get a little more complicated. For instance, if we have a word that ends in an A, we're going to change that to AE when we're making it plural. For instance, what's on your screen, if we want to change vertebra, which is one vertebra, to multiple vertebrae, then we're just going to add an E to the end of that, and that makes it plural. I know, I don't understand it either, but it is very simple. Every time that you have a singular of something that ends in A, put an E on it and it's plural. Every time. That's just the rule. So, and if it ends in an IS, change it to ES to make it plural, such as diagnosis versus diagnoses. And words that end in EX or IX, we're going to change them to ICES for the plural. So if we're talking about the apex or apices. So you can see that's the plural of those. And then ON or UM, we're going to change it to an A so we would have something like a ganglion that we're going to change to a ganglia, ovum to an ova. And then words that end in US, we're going to change it to an I. So bronchus will then become bronchi. So you can kind of see where the rules get a little off into the weeds when we're making the plural of things. But the good news is you can kind of bank on these rules being what they are. It's always going to be this. It is different than what you've learned in the classroom, taking your English classes growing up as a kid in grade school. However, it's just different. If you learn a different language, you're going to run into similar issues. However, just realize these rules are pretty straightforward. Okay, the more time that you spend with using these terms, the easier that will become. It'll be a little easier to swallow. Prefixes can be used to indicate numbers, colors, positions, or directions. So we can use prefixes for a lot of different things. Several prefixes such as uni, bi, multi are used to indicate if a term involves a number, like half, one, two, or more parts, those kinds of things. So we'll use that kind of terminology as a prefix so that we can kind of narrow down a number, or we can include a number in that. Several word roots are used to describe color, such as cyan, leuco, melon. Those kinds of things all indicate color. Cyan would be blue, leuco would be white, erythro would be red, melon would be black. Cero, I'm not really sure. That typically involves the liver where we see that, but I don't really know what color that one means. So that one's a mystery to me. I'd have to look it up. Prefixes can also be used to describe a position, direction, location. With some examples of that would be ad or trans. So those can help us locate or pin something down to a particular area or a particular place. Directional terms are needed to discuss where an injury is located and how pain radiates within the body. So sometimes we'll have to use some directional terms to kind of further distinguish where something is. If you've ever tried to describe where, for instance, a laceration on somebody's leg is, a leg is a fairly large body part. We need to narrow down where that laceration is. Where is it at? Is it above the knee? Is it below the knee? Is it on the inside of the leg? Is it on the outside? Is it on the back side of the leg? Is it above the ankle? Is it, on the thigh? Where is it at? And when we do that, we need to use terms that are familiar to everybody so it can, they can understand what it is that you're saying when that document is being read later. So, common terms that we use for direction, movement, and position are things such as right or left, superior, inferior, lateral, medial, proximal, distal, superficial, and deep. These are pretty common terms that we use. Now, when we're using, we can use some other terms like ventral or dorsal. There's even palmar, plantar, and even apex, which apex was mentioned earlier. Odd that it's mentioned twice already, and it's not a real commonly used term. But remember that whenever we're using terms like right and left, we're always referring to the patient's right and left sides, not our own. That's really, really important to make sure that you don't make that mistake. You're not talking about your right and left. You're always talking about the patient's right and left. The term superior refers to the part of the body closest to the head, while inferior refers to parts of the body closer to the feet. You can also use these terms to describe a relationship of one body part to another. So if we were talking about that cut on the leg again, for instance, if we said that cut on the leg is 2 centimeters superior to the patella, then now we've been very specific about it. It's 2 centimeters above the kneecap. So we can use that superior, inferior, to, based on one body part, we can say this body part, it's superior above it or below it. So that's how we can use that superior and inferior. Lateral and medial is similar to that. So lateral refers to body parts that are farther from the middle of the body. If we drew an imaginary line right down the center of somebody's body that separated right and left, lateral is going to be things further away from the middle part of that, and medial refers to things that are closer to the middle of that. So more to the inner of the body versus the outer of the body. Proximal and distal, similar to superior and inferior, we can use these terms in that same way. Proximal refers to structures closer to the trunk or the center of the body, while distal refers to structures farther from the trunk or farther from the center of the body. So you can also use that term where you can say it has been used before, although it's not ideal. Superior, inferior is a little better, but you can say, proximal or distal to the patella or something along those lines can be used in that way, although it's not really ideal because we're more talking about the trunk of the body versus a particular body part. Superficial means closer to the skin surface, while closer to the top of the surface, while deep means farther inside the body or deeper in the tissues, further away from the skin on the inside. Ventral and dorsal, these were always a couple of them that are always a little tricky to remember. Ventral and dorsal, just remember they kind of go together, but ventral refers to the belly side of the body or the front side, what we would consider the front side of the body, whereas dorsal refers to the spinal side or the posterior surface of the body. And the way that I always remember this is I always think of sharks have a dorsal fin and it's on the back of their body. So that's always the way that I manage to be able to remember dorsal. Your book uses a dolphin example. I kind of like the shark better than the dolphin. I don't know why. Anterior, posterior kind of goes along with that, dorsal and ventral. The more common terms that are more commonly used, of course, anterior refers to the front of the body, posterior refers to the back. So ventral, dorsal, anterior, posterior, they can go, you can use either one of those to describe, the front, back of the body. The front of the hand is called the palm of the hand or the palmar surface. And oftentimes people think of, they don't realize that the palm of the hand is actually the front of the hand, and the bottom of your feet are called the plantar surface. So palmar and plantar surfaces are terms that are really helpful. Apex, when we talk about an apex, it's the tip of a structure. And this is really used quite a bit when we're talking about organs. So for instance, the heart kind of comes down to a point, and the point we refer to as an apex. Same with the lungs at the top. The apex of the lungs is the top part of the lungs because it kind of comes up more into a point or a tip. The liver also has an apex. So there's several organs that have this apex to it. And when we're talking about the apex, we're talking about the tip of it. Now that can be a tip that's facing upwards or downwards, it doesn't matter, or to the side, we're talking about the apex of it, the tip of it, where it kind of narrows down and comes more to kind of like a point. Well, it may not be a sharp point, it may be a pretty blunt point, but that's what we're talking about. Then when we talk about moving things, movement terms, flexation is the bending of a joint and extension is the straightening of a joint. Adduction is motion towards the midline because we're adding it to the body. Abduction is movement away from the midline, it's being taken away. It's being abducted from the body. Other terms, body parts that appear on both sides of the midline are typically called bilateral. So this applies also to internal structures as well, such as the kidneys. When something occurs only on one side of the body, it's called unilateral. We may have, there are instances such as the liver's only on the right side of the body. I don't know that it would ever be referred to as unilateral, but when something is only on one particular side of the body, we're going to call it unilateral, but if it's both sides, we'll call it bilateral. So if somebody has bilateral fractures of their legs, we might say they have bilateral femur fractures. But we wouldn't typically say that someone has a unilateral femur fracture. We would say they have a femur fracture of the right or the left leg. So using these terms correctly ensures that other medical personnel know exactly what to look for, where to look for a particular thing, and what to expect. So these are really helpful. So there are many terms that can be used to describe a patient's position when you arrive for transporting them. A patient who is lying face down is referred to as prone, while a patient that is lying face up is in the supine position. So, I mean, literally, if someone's laying completely face down, that is prone. Face up is supine. Fowler's position is a position that we use quite a bit and we document quite a bit. Fowler's position has to do with someone sitting upright with, bent at the waist, sitting upright. So a Fowler's position in a semi-reclining position with the head elevated slightly, we typically place them in this position so that they can breathe a little bit better. A patient that is sitting straight upright is considered to be in full Fowler's position or in Fowler's position. Now, we can also document that as if they're slightly leaning back, maybe at a 45-degree angle, we'll document that as a semi-Fowler's position. And if they're at a full 90, we sometimes can call it a high Fowler's position or full Fowler's position. When you guys are doing your lifting and moving exercises in the classroom, this is one of the positions that you'll practice placing somebody in, and your instructor will talk about, semi-Fowler versus Fowler's position in the lab, so that you'll actually be able to see that put into practice. So let's talk a little bit. We'll spend the next few slides kind of breaking some of these terms apart so that we can help kind of figure out the meaning of how these words are put together. To define a medical, and this is a weird part about medical terms, once again, it's learning medical terminology is a bit like learning a new language, only it's really not quite as complicated. So, but the thing to realize about medical terms is we don't read them from left to right. We actually start with the end and then go back to the beginning and then read the middle. Seems a little silly, but we always start with the suffix first and then kind of work backwards. It doesn't, not really backwards, but we'll kind of start with the suffix and then go to the beginning. So if a term also has a prefix, we're going to define the suffix first, then the prefix, and then the root word. But if it has a suffix, if it doesn't have a prefix, we'll do the suffix and then the root word. So we kind of, like I said, it kind of gives the impression we're going backwards. We're starting with the end and then we're jumping all the way to the beginning and then moving forward from there. So let's do that here with this word. I put in a word in here, cardiomyopathy. It seems like a very complicated, very difficult word to understand, but if we start with the end like we're supposed to, we start with the suffix, pathy. If we start there and we know what pathy means, then we're going to go to the beginning. We're going to go to cardio, and this particular one, cardio is acting as either a prefix or it may be even a dual root word, but it's really acting as a prefix. And then we're going to go to my. So cardiomyopathy, when we break that word down, this is how we read that word. We'll start with pathy, go to cardio, and then to myo. So you kind of see how we hop to the beginning and then we go from left to right once we get there. Pathy means disease, cardio means heart, and myo means muscle. So if we're trying to figure out what this word means, if you literally look at what I just put on your screen and you start with the green, red to orange, or whatever color, the yellowy orange that is, then you see that that word actually means a disease of the heart muscle. I mean, literally, that's what that word means. Once you start to understand what each one's of these component parts are, for instance, if you know what cardio means, that you know that cardio means heart, then anytime you see cardio in a medical term, you know there's something about the heart. If you see myo in there, you know there's something about muscle, but you don't know what muscle. This one tells us it's about the heart muscle. So it's very particular. It really narrows it down for us. And then what is it that we're talking about? Well, pathy means disease. So now we're talking about a disease of the heart muscle. It doesn't tell us what specific disease that is, but it does tell us that there's some kind of disease condition of the heart muscle. That is how you break down these medical terms so that you can have a better understanding of what they mean. And this is what I'm talking about when I tell you, take the time to break these down into their component parts so that you understand what each one of those mean. And the more you do that, the better you're going to get at it. So here we are with neuropathy. So we're going to start with the suffix. So we're going to start with pathy, which you guys all know means disease now because we just did that. And this throws in that combining, O in there. So we're going to, that's included in there, but I'm not going to get off in the weeds on that. And then we have nepher or nephro, which means kidney. This doesn't have a prefix on it, so it's just a suffix and the root word. So now we have if we start with the suffix and then read the root word, we have a disease of the kidney. That's how it works. Simple as that. So dysuria, this one's a little bit different. Ia is a condition of. Then we'll go to the prefix, which dys means difficult, painful, or abnormal. So we have a condition of some kind of difficult or painful situation. UR means urine. So now we know somebody's having some pain or difficulty urinating. So dysuria means painful urination or difficulty urination. Hyperemesis. So now we don't have a suffix in this particular word. So emesis is our root word. Once we get familiar with and know what words are root words, we know that emesis means vomiting. So now we're going to go to hyper because we don't have a suffix. So if in the absence of a suffix, we're going to start left to right. Okay. So hyper means excessive. Emesis means vomiting. So hyperemesis means excessive vomiting. More practice that you do with these, the better you're going to get at them. Analgesic, which is the last one that we'll do. Ic means pertaining to, like we just did in one of the word a couple back. So that's our suffix. Our prefix is an, meaning without or absence of. So now we have pertaining to, not having, or pertaining to being without. Algeses, which means pain. So now we know that this word has to do with pertaining to not having pain or to being in the absence of pain. So an analgesic actually is lots of the medications that we have out of there. Tylenol is an analgesic. Morphine is an analgesic. So this has to do with relieving pain or doing away with pain. Or the absence of pain. Okay, so that's an idea of how to break down some of those words. Again, lots of practice, you're going to get better at that. Breaking those down and understanding what each of the prefixes, suffixes, and root words mean. And the only way that you're going to understand those is to repeatedly look them up or repeatedly do that until it's just natural, until it's, just kind of flows out of you. Once again, it's not going to be a bunch of test items of you breaking down medical terminology words, but there will be medical terminology words on your test that you're going to have to break down so that you can even understand what the question is asking you. So that's why it's really, really important that you start doing this now so that you have a better understanding of what those words are before it gets to a critical mode when you're starting to take those big time tests and you're really struggling with them. So medical abbreviations, acronyms, and symbols, these are something else that we oftentimes see in medical documentation, but it's really just a type of shorthand that we use for faster communication. I didn't include any examples in here, but you'll come across some of those examples because there's lots of them. But we should only use abbreviations that are commonly understood because this will help avoid any misinterpretations of errors. Actually, the Joint Commission and the Institute for Safe Medication Practices are the two main authorities on abbreviations, and they actually provide a do not use list of abbreviations out there because of their likelihood to create confusion and chaos or lead to medical errors. Remember to use only standard accepted abbreviations to avoid confusion and errors. You guys have already seen several examples of these. EMS is full of abbreviations as well as acronyms and not so much symbols, but there are some out there. For instance, abbreviations. EMS is an abbreviation. EMT is an abbreviation. So those are very widely accepted abbreviations. Acronym is a shorter term made from the first letter of each word in a phrase, and it is pronounced as its own word. For example, we use sample history. So sample, the word sample, signs, symptoms, allergies, medications, last oral intake, past medical events, and events leading up. So sample is that breakdown of an acronym that we commonly use in EMS, and they're typically used as ways to help us remember things. As you get further into the class, you'll have some that are, DCAP BTLS, or, there's several of them that are used in EMS and the medical field alike. So make sure you're familiar with those, and you're using those abbreviations that are going to be accepted. I mention abbreviations and especially acronyms because those are other things that you're going to see on exams and that kind of thing, that if you don't know what they mean, if you didn't take the time to learn what they mean when you were studying about them or reading them in your book, then you're not going to know what they mean when it comes test time. And if you don't understand what the question is asking you or all of the elements of that question, you have a very good likelihood that you're going to get that question wrong. So it's really, really important that you understand, that you take the time to understand these abbreviations, acronyms, medical terms, not so much symbols. You're not going to see much symbols on your testing, but it's really important to take the time now to understand those and learn those. Of course, symbols are used as a shortcut, and there's many different types of symbols out there, but we should only use some very specific accepted ones. EMS is not really a place that uses a lot of symbols. There are a few that are used, and that's why I didn't really get into that. So just be aware of the fact that you may see some symbols in there, and when you see those, you want to look those up, but you're not going to see those on your test and things like that. All right, so that's chapter 5. That is really just an introduction to medical terminology. It is really just basically the key that unlocks the medical terms, and not so much something that you need to worry about being on a big test. By itself, you're not going to have a test of medical terminology, but what you're going to have is you're going to have medical terms on your test. You're going to have abbreviations and acronyms on your test, so it's important for you to know how these things work. So start putting it to practice, so that way that you don't get surprised by any of those medical terms that come up. Okay, and I'll see you guys back at chapter 6.